Here we present the Bony Bankart auto bridge repair. The patient is positioned lateral, and a diagnostic arthroscopy is performed in standard fashion. The lesion is freed from the glenoid neck, and the subscapularis muscle is clearly visualized medially. Both sides of the lesion are then prepped. Next, two 1.8 millimeter knotless all-suture anchors were placed medial along the glenoid neck, just medial to the fracture at the superior and inferior 1/3 junctions of the lesion. Both repair stitch and passing suture are passed through the capsulolabral tissue with an arthroscopic lasso for later use. Following this, and not shown in this video, a 6 o'clock anchor as well as a knotless remplissage are performed. The bony Bankart is then reduced to the glenoid by placing additional knotless anchors above and below the bony lesion. To minimize suture traffic, the 3 anchors placed on the face are final tightened and cut. Next, we move to complete the auto bridge construct. An anchor is placed on the glenoid face at the inferior 1/3 junction of the bony fragment. The repair stitch from the inferior medial anchor is then passed through the knotless mechanism of the inferior 1/3 anchor that had been placed on the face of the glenoid. We then repeat these steps for the superior 1/3 junction. The repair stitch from the superior medial anchor is then passed through the knotless mechanism of the superior 1/3 anchor that had been placed on the face of the glenoid. Next, the repair stitch from the superior glenoid face anchor is passed through the knotless mechanism of the inferior medial anchor. This step is then repeated, passing the repair stitch from the inferior anchor of the glenoid face through the knotless mechanism of the superior medial anchor. Any final adjustments to the repair stitches is completed at this time prior to final tightening. This completes the Bony Bankart auto bridge repair.